Hi, my name is Annie Kate Hudson, and I'm an occupational therapy student. As a student, I am worried about the first few years of as an occupational therapist just because I have no idea where I will start. There are so many ways to go at a therapy intervention, and I feel as if I will have trouble remembering everything that I need to. With that being said, I've been looking recently for some sort of tool that I can use in the workplace that is a point of reference for me to use when I need a refresher on the models and the references or the frameworks that apply to occupational therapy. That's when I happened upon this extremely well-made, very creative piece of handiwork. It is called the OT Model 2000, which I have here clipped to my scrubs. And it provides the OT with 3 common models and 4 frameworks used in the OT field. For each one, you can find the primary theorists, the core assumptions, examples of when to use the model, and for the frameworks in particular, there's a section just for intervention techniques. And this is all just for $34.99. Just remember that this is a handmade product. We all know that as occupational therapists, it's very important for us to come back to the main values that occupational therapy is built upon. When we're in the clinic and we have all kinds of patients coming in with different backgrounds and different needs, sometimes we need a refresher on the models and the frameworks that we can potentially use. We may be treating one client from one particular model and realize that we need to change halfway through, and what better way than to have a tool to use that. Having the OT Model 2000 right at my fingertips, as you can see, it just clips right into my scrubs. Right here. It's not clipping. So then I can use it whenever I need to. As you can see from here, the PEO model is green and it has leaves, and that just reminds me of the environmental aspect of it, looking at the patient's context. The OA model has a lot of arrows going every which way, and that reminds me that I'm preparing the client for anything that could come their way, which means, from any direction like the arrows represent. And the MOHO model has a book, and that reminds me that it's all about structure, and if things are getting crazy, then I can always refer back to that for more structure. My favorite model is the OA model because of the empowerment it gives to the client, and my favorite framework is the biomechanical because of my history with kinesiology.